Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The purpose of this videotape is to illustrate the technique of replacing a corroded cervical amalgam with composite resin. A sandwich of glass ionomer, cement liner, and composite resin will be bonded to etched enamel, dentin, and cementum. Layers of different colored composites and color tints will be used to color match the different areas of the tooth. Scaling and prophylaxis are performed to remove pellicle, plaque, and any calculus which may hinder a proper margin and interfere with color determination. Preformed and custom-made shade tabs can be useful in determining color selection. For greater accuracy, curing the composite on the tooth prior to isolation is helpful. We can see that both color composites are close to matching the natural tooth color. However, dark gray is closest to the natural tooth color at the incisal, while dark yellow is closest at the cervical. These two color composites will be layered and contoured to more closely match the natural tooth color variation. For a better understanding of this concept, this illustration will be used to demonstrate the procedure to follow. The old amalgam and caries will be removed, and no attempt at internal retentive form will be made. Adhesion to beveled enamel and glass ionomer liner will provide the necessary retention. Dark yellow composite will be placed first to match the lost dentin and will be contoured more heavily at the cervical as dentin is in the natural tooth structure. A layer of dark gray will then be placed and contoured to match the enamel of the natural tooth. To increase the intensity of the color and to more closely match that of the natural tooth, it was determined that color tints were needed in this case. A yellow-orange tint will be placed on the cervical 1/3 of the composite and cured. A brown tint will then be added to match the root shade and cured. These tints will then be covered by a thin layer of dark yellow composite. This composite will protect the tint from abrasion and lend a lifelike depth of color. This layering and contouring process of tints and composites will allow most incident light to be reflected back from each layer, making the color come from within the tooth and giving the restoration a more natural appearance. This technique also minimizes the effects of composite contraction when cured. We will now clinically demonstrate the Class 5 composite restoration. Cotton roll isolation is used after the old restoration and caries are removed. The cavity is checked with an explorer. After rinsing the cavity preparation, a 10% polyacrylic acid rinse is used for 15 to 20 seconds to clean the tooth surface and to increase the bond strength of the glass ionomer by removing some of the smear layer. The polyacrylic acid is rinsed off for 10 to 15 seconds and quickly dried in order not to dehydrate the tooth. With new cotton rolls for isolation, the glass ionomer cement liner is placed over all dentin and cementum. 3½ minutes after placement, the glass ionomer cement liner will be ready for etching. Excess glass ionomer liner is removed, and the incisal enamel is beveled with a diamond. A gel etchant is used for 60 seconds on the enamel and for 15 seconds on the glass ionomer. When a glass ionomer is not used, a dentinal bonding agent is applied before and after beveling enamel to protect the dentin from the acid. No etchant gel is applied to either dentin or cementum unprotected by either glass ionomer or a dentinal bonding agent. The tooth is thoroughly rinsed and quickly dried. Remember, over-drying the tooth at this point before the bonding agent is applied will result in cracking of the glass ionomer. A dentinal bonding agent is applied in 2 thin coats and light cured for 10 seconds. Eye protection is used. The dark yellow shade of composite is layered by hand from cervical to incisal and contoured close to the final at the cervical, while at the incisal, room is left to permit placing of the next composite layer. The dark yellow composite is light cured for 30 seconds. The dark gray shade is now placed, which is layered more heavily toward the incisal and beveled down to the cervical. The dark gray composite is light cured for 30 seconds. Since the cervical chroma is more intense and the value lower than the available composite shades, tints are applied. Geriatric applications for this technique are numerous. Yellow-orange tint is applied and light cured. Brown tint is then applied and light cured. Dark yellow composite is then applied in a thin layer and cured. As you can see, a close color match has been achieved. A 7901 finishing burr is used to remove excess composite and to contour. The margins are evaluated with an explorer. A series of finishing discs and polishing paste are used to finish the restoration. The final restoration has the advantage of glass ionomer caries protection at the cervical, where traditionally the Class 5 restoration has failed due to recurrent caries. The restoration with the highest failure rate in restorative prosthodontics has been improved aesthetically and in caries protection.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.